Hello, my name is Benjamin Marion, and I am an occupational therapy student, and I am here to talk about how the field of occupational therapy can support people living with diabetes. Occupational therapy helps individuals do things they need and want to do independently. Everyday activities, usually referred to as occupations, are meaningful and typically things that we do in our everyday lives that we can't go without. And this can include things such as self care, managing your home, working, and doing other things that fulfill you. Um, Typically, we like to categorize these two types of activities into the two major categories of activities of daily living and instrumental activities of daily living. Activities of daily living more so contain things like bathing, grooming, dressing, eating, things that are essential to everyday life, versus instrumental activities of daily living, which include things like building budgets, um, going to the grocery store and shopping, social interactions, all those things which are more so added on top of all the other activities that are not necessarily as essential for daily living, but do form a part of our everyday. If you are living with diabetes, managing your health is a daily job in which occupational therapy can help. It is well known that managing your health on top of all the other responsibilities of every day can sometimes be overwhelming, it can be a little difficult, and it can at times be stressful. And this is where occupational therapists can work directly with you to create goals personalized to you to develop skills, routines, and in that process also help build that confidence for you to be able to independently or on your own manage those different aspects of your diabetes and to feel more comfortable taking on these roles without having to feel too overworked or stressed with all the activities of every day. So, how can occupational therapy help? So, occupational therapists can work directly with you, like I said before, creating goals and plans that work directly with your schedule, your lifestyle. And some of these examples can be like creating and sticking to routines for checking your blood sugar, taking your medications on a certain time frame. And they can also help with adapting homes or tools if you're experiencing pain, vision loss, and decreased energy. So it is within our role to be able to help identify areas where we can make your engagement with your job, with your home, with um, your community a little bit easier by adapting either whether that be suggesting adaptations to your home, to tools that you use every day, to utensils, kitchen utensils as well. So it is something where we can make that engagement a little bit easier. We can also work with making healthy food choices and preparing meals, more so having like creating journals and doing constant checks where we can make plans as to what would be a healthy replacements or healthy ways of dealing with different food choices. And one of the big ones that um, has recently been very important is managing stress and emotions that come with a chronic illness. Sometimes it is very common for these things to be ignored. And when it comes to having a chronic illness such as diabetes, managing that stress from that burden or that overwork of having to manage all these different little aspects of life can be a lot. So, occupational therapists can help with different techniques of managing stress, emotions that come with it to maybe reframe some of those thoughts to help achieve more of a positive outlook and also help reframe those thoughts in order to find solutions to these areas or these barriers that might be stopping us from engaging in a lot of activities that are important. It is important to keep a close and open communication with your primary care physician um, because managing your diabetes can be very difficult. It is important to always keep a close communication to see where there's areas that can be improved, areas that can um, be changed. so that they better work with you and your needs at that current moment. Occupational therapists, like I said before, help work with you directly, and they meet you where you are at the moment, and they help develop those goals for what you want to get to, and they help you live a fuller life while managing that diabetes, and they show you skills of how to also keep that communication open by keeping a journal that has a schedule of your routines of different readings that you've gone, helping understand the numbers and the data that you're receiving so you have a better understanding of what your healthcare looks like at that moment. So occupational therapy is a good source for getting and understanding better your condition and also helping develop those skills that can make management a little bit easier. Thank you so much for your attention, and hopefully, this video served as a good resource to help inform you a little bit more about how occupational therapy can help support that self management of your diabetes and make that journey a little bit easier through a variety of goals, skills, routines, and different forms of interactions. Thank you.